So, from an industry perspective, we're always busy trying to pre-solve the technical problems that we think the health IT vision is going to create in the future, right?
Trying to stay out in front of it.
Yeah, trying to stay in front of the curve whenever possible. So, we've been desperately working to drive down the cost of virtual desktops and of remote telepresence and different things like that they need. One of the things that's personally fascinates me and fascinates NetApp as a company right now is how health IT is going to interact with the cloud, especially as you start looking at public cloud offerings, right? So we've already seen approaches to this from, Google Health so many years ago, right, to the new Apple Health Kit, all the different things that are happening there. So fundamentally, you're talking about some of the most private data imaginable, right? Not even getting into the HIPAA and PII and anything like that, but just very privately held data. And you're balancing that against what's probably going to be the most disruptive technology change of this decade, if not future decades. So, one of the things NetApp is looking at is how do we're noodling over, how do we leverage the cloud, but as an extension of private on-premise data? How do we take all the protections that some of these agencies would normally wrap around their data, that you'd expect around your private medical data, whether it comes from data protection or encryption or any of those other faculties, and how do we then extend that out into the public cloud? So we're looking at, is it possible to take all those common data management, all those common data protection techniques and extend them out even to public hyperscalers like Amazon?
Sure.
So that's a lot of what NetApp has been working on, is those partnerships to really provide that data protection, provide that data integrity, but let these agencies leverage the fundamental economies of scale you get out of private clouds and hyperscalers.
Yeah, excellent.